coming today. As I said earlier, my name is Sue Flanagan. I am from Blue Cross and Blue Shield. This is not a Blue Cross and Blue Shield product presentation. If you have any questions on our products, I'm always happy to help you. Maybe at the end of the presentation, I'm happy to sit down with you or answer any questions. But this presentation right now, what we do is that you're probably well aware that every year, if you're on a Medicare plan, at this time of the year, come October 15th through December 7th, you can re-look at your plan and decide if it's working for you. And if it is, your plan just continues on. If it isn't, this is the opportunity that you can look at the different types of plans out there available. And then there really are two different types if you're buying insurance on your own. The first type is called a Medicare supplement plan, and the other type is called a Medicare Advantage plan. And neither plan is better than the other. There's just weights and balances to both of them. And sometimes there's a very clear path for people, and other times you're lucky enough that both plans may work for you. Just before I get started, it helps me to understand the group on what type of plans that you have in here. So how many people are on a Medicare supplement plan? And that would be like if you're a Blue Cross Medex plan, Medex Core, Medex Bronze. Okay, great. So a lot of you are on a Medicare supplement plan. How many people are on the Medex Bronze plan? Just one. All right, a couple. Okay, so after the presentation too, we can talk because there's a new plan that you might want to look at. I know everybody loves Medex Bronze, so you don't have to change, but also there's one that's very similar to it called Medex Sapphire, so I could go through that with you. And how many people are on a Medicare Advantage plan, an HMO or PPO? And which company do you have?
Tufts.
Tufts, okay. Same.
Tufts.
Okay, great. And anybody on a Blue Cross Medicare Advantage plan? No. So mostly?
No, I'm sorry.
That's all right, and one person. Okay, so great. So we have a good mix. We have
Just a quick question.
Yeah.
I'm on the Medex. It says HMO though. Someone had written HMO on it, supplement.
So a supplement plan would never be an HMO. If you're on Medex, you have a separate drug card, right? Do you have a separate drug card? A separate plan for your medication? Yeah, so you're not
No,
on
I
an
don't
HMO.
have, I have to go elsewhere for medication.
Yeah, so if you're on Medex, you're on a supplement plan.
Yes,
Okay.
okay, so just a straight supplement.
Just a straight supplement, yep.
What's Medex? I'm on a Harvard Pilgrim Health Care, HPHC supplement.
A supplement, okay, great. So yeah, so your question is what is Medex? The term supplement is a term for a type of health insurance, and we're going to go through all of that, but what happens is that Blue Cross, we confuse it a little even more because we brand our supplements and we call it Medex. So for the Blue Cross members, that's how they're going to recognize that they're on a supplement plan.
Okay,
Okay.
thank you.
You're welcome. All right, so let's get started. The choice is yours, Medicare supplement or Medicare Advantage plans. So first thing we'll do is we'll do a quick review of Medicare. Then we'll talk about the Medicare supplement plans, Medicare Advantage plans. We'll compare them. We'll do a case study. We'll talk a little bit about prescription drug coverage because that comes into play in your decisions. Things to consider and additional resources. So this slide right here is what I was mentioning earlier, is that once you go on to Medicare, you could have Medicare alone and nothing else. And if you just have Medicare alone and nothing else, a very oversimplification of Medicare is that it's an 80-20 plan. Medicare pays 80, you pay 20%, some deductibles, but you go to any doctor, any hospital that takes Medicare, no referral. You could stop right there and do nothing else. So I just want Medicare, nothing else. But if you want more insurance than Medicare, then you're looking to a private insurance company for that additional insurance. I always like to say the first thing you want to know is if you work for a company for 10, 20, 30 years, your first question to yourself is, well, when I retire, if I'm retiring, do I have medical retiree coverage through that company? If you do, you're usually choosing the options that that company is offering you. But most people, they don't have that coverage. So now they're on their own looking for their own insurance. And when you're out there looking, there's two distinct pathways for you to go down for that additional coverage. One of the pathways are called Medicare supplement plans. And these are plans that pick up the 20% for Medicare left off. They don't add in a whole bunch of extras that Medicare doesn't cover. So you're typically not seeing money towards your glasses, dental cleanings, and you have to buy a separate prescription drug plan. So that pathway is typically the most expensive monthly premium pathway that you can go down, but the least amount of money out of your pocket when you see those doctors or hospitals. We're going to take each one of these boxes one at a time and go through it. But a whole different way of doing things are Medicare Advantage plans. And these are sometimes called Medicare Part C or optional replacements to Medicare. They include the prescription drug coverage, they include extras, money towards glasses, maybe dental cleanings. These are the plans that you're seeing on TV all the time with the celebrities. I think it's William Shatner, Joe Namath. I guess you'll see Lionel Richie coming up this year is what I've heard. So these are lower monthly premium, advertised zero premium or lower premium, extras, but you pay some co-payments as you go. So as I said, neither way is better than the other. There's just a weights and balance, and that's what we'll go through in this presentation. We're going to start with Medicare. Medicare is health insurance provided by the federal government. It's broken down into two parts. We have Medicare Part A and Medicare Part B. When you think about Part A is your hospitalization and skilled nursing. And when we say hospitalization, what we mean by that is it's your room and board, lab, equipment, everything you're doing in that hospital minus your doctor care. So doctor care is always going to fall under Medicare Part B. So Part A is premium free for most people. In 2023, we have the new Medicare figures. If you went into the hospital and you only had Medicare, you would be covered your first 60 days at 100% after you paid an initial deductible of $1,600. So whether you're there 1 day, 10 days, 60 days, if you left that hospital, you'd get a bill for that deductible of $1,600. After that, if you're in the hospital, you start to have daily charges. But Part A, it works off of what we call a benefit period. And a benefit period starts the day that you enter that facility and ends when you've been out for 60 consecutive days. So if you just had Medicare alone and you went into the hospital, you are going to pay, that $1,600 for those first 60 days. But an example of the benefit period would be, let's say you're in the hospital for 10 days, you'd get that bill for $1,600. But if you went home for a few days, you went back in the hospital, you're not going to pay that again. They're just going to pick up where you left off. But if you went home for 4 or 5 months, longer than those 60 days, when you go back into that hospital, it's a new admission, everything resets, they count day 1, day 2, day 3. That's how you pay that deductible again. So Part A works off of a benefit period. It's your hospitalization in your skilled nursing facility. Skilled nursing facility, you do need to be admitted in the hospital 3 days prior. Then Medicare covers you the first 20 days, but at day 21 through day 100, you start to have a daily charge. That's Part A. Part B of Medicare, that's all of your doctor care, whether you're in or out of the hospital. It has a monthly premium. If you're on Medicare, you probably saw the news, it's going down a little bit this year. Part B this year is $170.10. In 2023, it's going to go down to $164.90. Again, that's per person per month. That's for your Medicare Part B. And then with that, under Medicare, it covers all of your doctor care, outpatient services, but it has a calendar year deductible of $226. So in this example, the first time that you see a doctor every year, you would have gotten the bill for $226. After you met that deductible, you no longer would pay it. If you just had Medicare alone, Medicare would pay 80% and you would pay 20%. Medicare does not include prescription drug coverage. That's going to be Medicare Part D. So if you're picking up prescriptions at your local pharmacist, not under A or B, a separate plan for Medicare Part D that we'll talk about later on. Any questions just on Medicare? Sure.
I'm a retired nurse.
Yeah.
There used to be a problem that you had to make sure you were actually admitted to the hospital and not under observation. Do we still have to do that?
You do, yeah. So under, her question is on observation. So if you only had Medicare and you went into the hospital, what would happen is if you're admitted, an admitted status, you're covered for your first 60 days at that $1,600, and then your doctor carries 20%. But sometimes for the skilled nursing, you need a 3-day admission prior for that skilled nursing to be covered. And if the doctor put you in as observation, it's not going to count as admitted. It's kind of under that Part B, and you need it for you need a 3-day hospital stay to be able to have the skilled nursing covered at that 100% for those first 20 days. Now, in years past, when you were admitted in the hospital, you never knew if you were in an admission status or observation status. They do need to let you know that at this point. So.
My aunt recently went to the ER. She was in there all day, and the doctor wanted to keep her for observation overnight. She signed admittance papers. So I assume the board or whoever, the administration, decides who's going to stay in a hospital room. Was she admitted, or was she there for is that where that kicks in?
Yeah,
They said both.
I'm not
And she
sure.
signed admittance papers to be there. And to dismiss, she had to sign dismissal papers to get out.
I imagine she was admitted then. If it sounds like that, she's signing admission papers, but I don't know. I don't work at that level within the hospital setting. But what I can tell you is that you do need, if you ask, they can tell you if you're admitted or in observation. And it doesn't always mean that observation is the worst thing to be in. Sometimes on plans it's going to work out the best, but where you do need to worry about it is that if she was admitted and you thought she needed skilled nursing care, that's when you really want to be aware of it if she's going to go to a skilled nursing facility. Well, is she admitted or is she in observation? And there's a lot other to it. I mean, there's sometimes that people are part of an accountable care organization. Sometimes the 3 days is waived. So that's a whole nice question, but a whole other
Most
topic.
of us are aware that the insurance companies are out to rook us.
Yeah,
And we're trying to figure out how to rook the insurance companies.
yeah. Well, it's actually a Medicare. It's a Medicare rule. It's not through the insurance. So this is Medicare, and then when we talk about insurance, they pick up where Medicare left off. So there's been a lot of legislation to try to change that, and it's, as I say, it's not as simple as just giving a few questions. You could have a whole presentation on that topic. But for the purposes of today, for hospitalization, if you're admitted, then you go into skilled nursing under Medicare. You have the first 20 days covered at 100%. If you don't have that admission status and you go into skilled nursing, Medicare's not going to cover it. So you want to be aware of that. So now what we're going to do is we're going to move on and talk about plans that you can add on to Medicare to simply pick up where Medicare left off. So this term for this type of health insurance is called a Medicare supplement plan, is what we're talking about first. You might have also heard the term Medigap plan. So if you've done some reading, you see the term Medicare supplement, Medigap. Those two terms are used interchangeably all the time. They mean exactly the same thing. They're a type of plan that's filling in the gaps where Medicare left off or supplementing where Medicare left off. These are plans that you're buying from a private insurance company. So you're buying them from Blue Cross, you're buying them from another carrier, from your Harvard Pilgrim. These plans, the job of them is that Medicare is your primary insurance. So Medicare is the insurance, and you're buying a secondary insurance through that private company to simply pick up where Medicare left off. So when you go to the doctors on these cards, you show two cards. You show your Medicare card and your health plan card. The doctors are going to bill Medicare. Medicare is going to pay its share. Whatever's left over, if you didn't have health insurance, they bill they bill you the leftover amount. But if you have health insurance, they're going to bill the health insurance the leftover amount. So every supplement plan is picking up that 20% that Medicare left behind. But based on the product that you buy, they may pick up different deductibles. Those premiums, they range anywhere, in 2023, it's more like $120 something to $220 starting for this range of products. Each one of those companies are always picking up that 20%, but depending on the product, again, it will pick up difference. And we'll look at that on the next page. But just want to explain that with these plans, the health plan isn't making the rules of the plan. We're not making the provider directory booklet. It's all Medicare. Medicare is your primary insurance, which means you can go to any doctor, any hospital that takes Medicare, no referral. So you're not calling Blue Cross, you're not calling another company and saying, can I see this doctor? If they take Medicare, you can, because all the insurance is a payer. We know Medicare is going to pay most of the bill, and we're going to bring in enough money every month from that membership to simply pick up where Medicare left off. So lots of freedom of choice, any doctor, any hospital, no referral. The types of plans that will be available to you, they're regulated by the Division of Insurance, and they're called Supplement Core, Supplement 1A, and Supplement 1. The Supplement 1 plan, that's the easiest plan to understand. And all you have to do to understand that plan is to know that if you're on Medicare in a Supplement 1A plan, there's no cost for your care. So you go to the doctor, lab, x-ray, hospitalization. Medicare pays first. The Supplement 1 is picking up where Medicare left off. So for the Medix Bronze members in here, you're on a Supplement 1 plan. You know you're paying $220-something a month times 12, and you go in any doctor, any hospital, everything's covered for you. There should be no cost for you. So that's one of those options. Supplement 1A, this was a newly created option. I think it was last year or the year before. Now my years are mixing together. But why it was created is there was some legislation that said Supplement 1 plans like our Medix Bronze, people are grandfathered in that are on those plans, and people that were age 65 prior to 1/1/2020 or eligible for Medicare due to disability prior to 1/1/2020, they still can join that Supplement 1 plan. But if you're sitting in the audience today and you're saying, well, I just turned 65, that's not going to be an option for you because you needed to be eligible for Medicare prior to 1/1/2020. So for the supplement plans in Massachusetts, you'll have two plan options to choose from. The first one is the Supplement 1A plan, and that is just like that Supplement 1 with the one exception. You're going to pay the Part B deductible each year. So in 2023, that Part B deductible is $226. So let's say you go to the doctor, maybe they charge $500. On that plan, you'll pay your first $226. After you pay that, every time you go to the doctor, lab, x-ray, hospitalization, you'd be covered at 100%. That plan runs different. Every company will have a different premium or so. anywhere from $180, $190 something a month for those supplement 1A plans. And all those premiums are always per person per month. And then we have the supplement core plan. Same thing for doctor care. You pay your Part B deductible each year, that $226 in 2023. But on that plan, if you end up in the hospital, you are going to pay the hospital deductible and the skilled nursing daily charge at day 21. And that one runs about $120 something a month. So 3 different options, all regulated by the Division of Insurance, whether you come to Blue Cross or Harvard Pilgrim. I know that's what you have, that's why I'm saying their name. Or whoever else you choose, these will be the options for you to choose from in Massachusetts. No pre-existing conditions, no health screenings. Lots of flexibility on the supplement plans. If you say, well, I'm going to take the supplement core, I'm not worried about that hospitalization, maybe I'll pay the lower premium, and all of a sudden you need to move to the supplement 1A, you're able to do that any month. Whatever month you call, and I'll speak for Blue Cross, will move you up or down the first of the following month. So if you're on the supplement core and you get in a car accident and you know you're in the hospital, you are going to pay that hospital deductible of $1,600. That's the plan that you have. But if you're on that plan and all of a sudden you say, well, in a few months from now, I know I'm going to need the surgery, I'm going to have to be admitted into the hospital, you could call member service. We'll move you up whatever month you call, the first of the following month, no problem. So these are the only plans we'll talk about here today that have that type of flexibility. The others are, you know, this October 15th through December 7th timeline of being able to change your plans. Again, the supplement plans have no prescription drug coverage. So think about these plans are ranging from $120, $200 something, $20 a month. Any doctor, any hospital, predictable cost, but you need to buy a separate prescription drug plan. Any questions on the supplement plans? Sure.
General question, do the hospitals have a Medicare representative or someone in their facility to advise families and people that are admitted at the time regarding their billing and insurance prior?
I'm not sure what the hospital setup is at each hospital for how they counsel you on the insurance or the financing of it, but to that extent, if you have questions ahead, one of the great resources about insurance is right here at the Senior Center or the Council on Aging is SHINE, Serving Health Information Needs of Everyone on Medicare. So you can make an appointment with them. They'll know all the information that we're talking about here today. Are you a SHINE counselor?
No, I'm not.
No.
It just seems to me that in an emergency, and Medicare is number one as far as hospitalization, billing, and cost, that someone should be there in the hospital. It could solve a lot of problems right at the get-go.
Sounds like a good plan. I'm not sure that that is the case, but
I thought there might be some
Yeah.
law, someone working
no, I
on
don't
that.
think so.
some-
But
yeah.
there is I'm sure there's somebody that deals with the finance in the hospital, but are they there when you're admitted and talking to you? I don't think so. But maybe you could ask.
Prevention, not
Yeah.
perfection.
Yeah.
I have a question on top of his. I'm usually using the emergency room, you are in a situation that you're emotional and whether it's you or the loved one. But it was the 3 days that caught I knew you expressly have to find out whether it's observation or admitting, like it's two different. The way he questioned it, it was like, well, when you signed admitting papers, were you really signing for observation and just given the approval that you knew it was observation? So that kind of left me in a gray area. But the other thing was the 3 days minute. If they put you and admit you 3 days, it has to be a minimum of 3 days that you're in there, or not being charged something.
Well, the 3 days say hospitalization is,
Assuming it's a skilled, because hospitals usually have skilled care, nurses and.
yeah. So the hospitalization, when you go into Medicare, you're covered your first 60 days, whether you
Right.
the 1,600. What happens is when you are leaving that hospital, let's say you're just going home, and let's say you had one of these supplement plans, if you have the supplement 1A, it doesn't matter if you were admitted or not admitted. On that plan, you would have paid just the Part B deductible, the $233. On the supplement core plan, if you were admitted, you were going to pay the $1,600. If you weren't admitted, it falls under Part B. You were just going to pay that first. You might pay nothing if you already paid that Part B deductible. So it's not a big black hole that you don't have medical coverage, that you have to worry about it for each one of those things. What you do need to worry about it is, I'm here, I'm not sure my family member is going to be ready to go home. They're going to need to go to a skilled nursing facility. That's where it's very important to say, are they admitted or are they in observation? And that will be with Medicare and the supplement plans. When we talk about Medicare Advantage plans coming up, and how you said, that's a Medicare rule. Supplement plans follow Medicare rules. When we go on to the Medicare Advantage plans, you could ask your Medicare Advantage plan if you're worried about that 3-day admission. On Blue Cross's Medicare Advantage plans, we don't require the 3-day admission for skilled nursing. So it's a little bit more than, just, you might say, well, I need to be admitted. And on
Right,
some plan, you
right.
might pay more if you're admitted. You need to be admitted if you're on Medicare or a supplement and you're worried about the skilled nursing facility, or you want to be. And it's always best to be an educated consumer and ask those questions. But at the end of the day, too, it's really, no matter what we want, the hospital's still going to put through what they want to put through as well.
Unless you pay like
Go ahead. Maybe.
You have to.
But I think it's all, and maybe you can speak to it, I think it's all behind the scenes on how they're coding it and what they're putting in.
That's true, coding is extremely important now.
it drives everything.
So any last questions on the supplement plan?
I'm on the Sapphire plan.
You're on the Sapphire,
Okay,
so
what's
that,
the difference between that one and the supplement one?
sure,
I know it pays deductible,
yeah.
that one doesn't. What's the difference in the premium? Would it be more or less if you are the father's paying deductible?
So his question is on a Blue Cross plan, on our Medics plans.
I used to have the other one.
Yeah, so the Medics Bronze plan, which is the supplement one,
It only pays deductible, not pretty much.
yeah,
The premium is more than deductible, that's the question.
yeah, it is. So the Medics Bronze at Blue Cross, for a Blue Cross member, is $229.51 come 2023. So $229, you're gonna go to any doctor, any hospital, all the Medicare covered services are covered at 100%. But if you went to the supplement 1A plan at Blue Cross, again, we brand it and we call that Medics Sapphire. And that plan is $192.63. And his question is, what is the difference? The only difference is that Part B deductible, that you are going to pay that on the Sapphire plan, and that's $226. So when you do the math out financially, you will make out better on the supplement 1A plan than you would on the supplement 1. So I think that was your question. Yeah.
Better off with that then.
You're better off with the 1A. And as I said earlier, we have Medics members that have been on our Medics Bronze forever, and they're worried about losing that coverage, or what if things change. You can stay on that plan as long as you want, but you eventually, at some point, you might say, well, I feel comfortable moving to the supplement 1A. Whenever you do, give us a call, we'll move you down. And worried, oh, maybe that deductible's gonna go up, you can move back
Just
up.
try to compare the both.
Yeah, you can look at it each year, yeah.
But the terminology is now different. It's not bronze and gold.
You
There
never,
is no gold.
I know. it's
there,
long
the
gone.
terminology,
It's
'cause
half, I
when we try to do it here, we try to not do just Blue Cross products.
Yeah,
um,
okay.
Just so it's more educational. I know it gets
Okay.
confusing.
Okay.
So those are, you could go really to any carrier and buy these plans.
Okay.
Just that Blue Cross rebrand it with that meta. That's
Great,
why it gets
thank you.
confusing, yeah.
I was under the impression that you could not get bronze anymore.
People still can join the Medics Bronze plan or any Supplement 1 plan from any other carrier as well, as long as they meet the eligibility requirements, which is you live in Massachusetts, your Medicare A and B, and you are eligible for Medicare prior to 1/1/2020. So anybody that was 65 before 2020, that could have been on Medicare, they can still join that plan. But anybody just turning 65 now, their choices is the core or the supplement 1K.
Any savings I made quarterly?
I don't believe so. At Blue Cross's question, is there any benefit in paying quarterly? No. At other carriers, I'm not sure. Yeah. Okay. So now what we're going to talk about are the Medicare Advantage plans. So some people are going to have the supplements, any doctor, any hospital that takes Medicare, no referral. We saw really no co-payments, but we didn't talk about extra money towards glasses, dental cleanings, drug coverage. If that's important to you, there also are called plans called Medicare Advantage plans. You never do both, it's one way or the other. Again, multiple companies offer Medicare Advantage plans. Most of them have plans that have a zero premium plan, ranging up to a couple $100s a month. The most popular Medicare Advantage plans are usually the lower premium plans, the $0 to $100-something. And one of the questions that I always get when we're out in the community is like, are these scams? How can something be zero cost? And no, they're just funded very differently. So what happens is when you join one of these types of plans, Medicare is going to send the health plan a set amount of money every month for every member that's on that plan. So let's say you join a Medicare HMO plan. We get this money for Medicare. If there's a premium, you send the premium. We take the Medicare money, your money, we pool it together. We contract with doctors and hospitals. We give you all of your Medicare covered benefits, plus additional benefits that Medicare doesn't cover. The money toward glasses, the dental cleanings, the drug coverage included in it. In exchange for that, when you go to those doctors or the hospitals, you no longer show your Medicare card anymore. You always have Medicare, you need to continue to pay those Medicare premiums, but you put that card aside and you just show your one healthcare card when you go to those doctors. They bill the healthcare company, the healthcare company pays the claims out of that pool of funds, but you're always going to have a co-payment or cost along the way. So when you join a Medicare Advantage plan, think lower premium, you never lose Medicare benefits, but they're not what we drilled down into. They're going to be what the plan has decided. So maybe I have a zero premium plan. When I go to the doctor, I pay $10, specialist $40. You're looking at those plan designs to see how those plans run. In Massachusetts, there's pretty much HMOs and PPOs. An HMO is a health maintenance organization. When you pick an HMO, you need to get referrals. Plans, you don't just make appointments with dermatologists or cardiologists. They're coordinating that care for you. On a PPO, preferred provider organization, you don't need a referral. They encourage you to have a primary care type doctor because they want somebody looking out and coordinating your care for you. But you never have to do that if you don't want. You can stay in network to see contracted providers, or you can go out of network to see any Medicare provider. So it gives you a little bit more flexibility. Back to your question earlier about is there somebody in the hospital regarding your insurance and I wouldn't say say there's somebody in the hospital on a Medicare Advantage plan, but with these plans, if you have medical conditions or questions or you're worried, you have a condition, you can be assigned a case manager. So if you're in the hospital, you can ask for a case manager and they help oversee your care for you. So there's more coordination that the health plan can work with you while you're in those hospitals or those types of situations. So any questions on a Medicare Advantage plan? And then we'll compare them. Sure.
Well, what does the D stand for in MAPD?
Oh, sure. So an MAPD, Medicare Advantage plan with drug coverage, so prescription drug coverage. So there are some Medicare Advantage plans without prescription drug plans. Most of them have it. I work at Blue Cross. We don't have any without the drug coverage. But there's a few carriers out there that offer them because there might be people that are veterans that they don't need the drug coverage. But it's good to know if you ever come across one that doesn't have the drug coverage and you don't have the VA or some employer coverage for a prescription, you can't take this plan and then go buy a separate Part B. They cancel each other out. So most of the time for people buying a Medicare Advantage plan, it's your medical prescriptions all in one.
Thank you.
You're welcome.
Can you switch back and forth between Advantage and Supplement?
You can switch between plans, Medicare Advantage Supplement, once a year, that October 15th through December 7th. Every year, you don't need to worry, but it's not how I talked about earlier, every month moving back and forth. So now what we're going to do is we're going to look at the differences between these plans. So the supplement plans that we talked about, if you're on MedX, you're on a supplement plan. These are plans that Medicare is paying first. You buy a health plan to pick up where Medicare left off. 3 options, the core, 1A or 1. All pick up that 20%, but leave some different deductibles. Any Medicare provider, no referrals required, 0 cost sharing on that supplement 1 plan. The 1A and the core, there's limited amounts, you're pretty predictable costs. They don't include eyewear, hearing. A lot of the plans, though, if you say, if that's a deal breaker for you, a lot of the plans might have a rider that you can buy, very inexpensive if you need to add on that vision or hearing. But none of them will include the prescription drug coverage. You have to buy a separate prescription drug plan. Versus a Medicare Advantage, these are those HMOs and PPOs, and Medicare helps fund those plans. You show the 1 card when you go to the doctor. You have an HMO or a PPO, ranging in premium from 0, so you can buy a 0 premium plan on up. There is a network on both of those plans. On the HMO, you have to stay in the network with the referral. PPO, you have in network, usually your cost is less, or you can go out of network to any Medicare provider. Routine dental, vision, hearing, usually included in all the plans, and the drug coverage included in all the plans really, except if you're, again, let's say you have the VA or you have drug coverage from somebody else, you may be able to buy one of those policies. So now we are going to do a case study and just look at these plans on what your cost would be. So we're going to take the supplement 1A plan. That's the supplement, let's say it's around $185 per person per month. Times it by 12, your out-of-pocket cost for that plan for the premium is $2,020. On that plan, you're going to need to meet your Part B deductible. So you're going to have to eventually pay that $226 if you have any medical care. But after that, let's say you went to the doctor 3 times, the specialist, lab, MRI, outpatient surgery, 000 cost. Your out-of-pocket cost in this plan for that year was $2,446 for all of those Medicare covered benefits. If you had no visits, except for, let's say, 1, your cost is still going to be that $2,446. If you had 100 visits, it's still going to be that cost. So the supplement plans are very predictable. You just need to keep in mind, again, you're going to buy a separate prescription drug plan. Now compared to a Medicare Advantage plan. Let's say you buy a Medicare Advantage plan for $100 a month. So your premium is about $1,200 a year. And then you said, well, on my Medicare Advantage plan, I went to the doctor 3 times last year, and my copayment was $10, so that's $30. I went to the specialist 5 times for a $45 copayment, so that's $225. I went for lab tests, x-rays, and so just a general idea of here's some costs. You can see that your annual premium and the cost that you paid in this example came out to be about $2,235. Let's take that example and say that you had a 0 premium plan, so you paid nothing. And then, so 0 premium, then you're going to pay about $1,000 out of pocket in those costs. Let's say you took a 0 premium plan and you only went to the specialist 5 times. That's all you did that year. So 0 premium, you paid $225 out of your pocket. You have your medical prescriptions extra. Worked out really well for people. So this plan you can see, based on your care, is always going to determine your out-of-pocket costs for that year.
This is just for you still in your network, your doctor network.
Well, this is a PPO. It's just an example. So you could be out of network on this plan, too. It's just a fictional, it's not a
Or
true.
the cost would be more for the network.
Yeah, the cost is a little bit more out of network, but you could look at the PPO. Some is not much more out of network depending on the services. So typically think a little bit more, but a lot of times it's not large, a whole bunch more. But let's take that example. Let's say last year you had a 0 premium plan. You went to the doctor, 5 specialists 5 times, $45. You paid $225. But you thought that was going to be your year again, but it wasn't. It was a terrible year, and let's say you went out of network all the time because you found a doctor that you needed to see. So you keep having all of these costs add up. On a Medicare Advantage plan, they all have something called an out-of-pocket max. That's our protection for you. That's the most that you could pay in a given year towards your Medicare covered services. So that's also something you can look at when you're evaluating Medicare Advantage plans. Well, this plan's a 0 premium plan, this plan's a $100 plan. What's my risk factor if I had a really bad year? And those are typically, the out-of-pocket max typically ranges from $3,400 to $6,700 something dollars. Every company, every plan can have a different one. They're very hard to reach, but if you had that bad year, it's there as a protection for you. So again, not really predictable costs, but there is a protection for you. What you're going to pay is really going to depend on the type of care you received that year, but includes medical, prescriptions, extra. And as your question, can it change? Every year. So you can only, nobody has a crystal ball. You can only look at your current situation, the plans that are available, and you pick the best one. It's not a lifetime decision. You can change every year. And just know, I'm just going to run there, see if there's there. If you ever are on the wrong plan, come down here to the Council on Aging, talk to Shine. If there's a special enrollment, there's a whole bunch of different things that may allow you to change. You can talk to them. You can call your carrier, but don't sit on a plan that isn't working for you. If there is a way you qualify for any special enrollments, the health plan of Shine can help you find it. Any questions on those case studies? So just prescription drug coverage. We can't do this presentation without mentioning the prescription drug coverage. So it's not clear comparing a Medicare Advantage plan to a supplement, because the supplement doesn't have drug coverage, and it's probably something you're going to need. if you don't have prescription drug coverage with Medicare or supplement plan, and you don't have what the government calls creditable coverage, prescription drug coverage as good or better than a Part D plan, then if you ever want to get onto one, you get a late enrollment penalty. So creditable coverage, if you had the VA, if you had an employer plan for drug coverage, those are typically creditable coverage. But if you don't, and you're going with Medicare and a supplement, you're typically going to need to buy what we call a standalone prescription drug plan. In those prices this year, there's a wide range of premiums. I think the lowest one is in the Medicare and UCAN booklet. It's $6 and change. They go up to over $100. So you want to look at those Medicare Part D plans. Average premium is about $30-something a month for a Part D plan. But to find the best Part D plan, what you can do is you can call Medicare, you can come down here and meet with Shine, you can go online on Medicare, put in your figures, and what will happen is, or even sometimes your pharmacist at your local pharmacy, you let them know to run a Part D comparison. They'll tell you the best Part D plan to buy based on your medications, because at the end of the day, it really doesn't matter if you're spending $7, $30, or $50. You want to find a plan that's you're going to pay the least amount of money out of pocket in premium and co-payments, and that computer system will do that for you. So again, on the Medicare Advantage plans, you do want to note that most of them include drug coverage. They are Part D, that's embedded in there. You don't want to go out and buy it on your own. It will cancel it out. The only Medicare Advantage plans without prescription drug coverage, anybody can join them, but if you do that, you'll probably eventually get a penalty if you want to come into any Medicare Advantage plan with drug coverage or buy a Part D plan. And always check your formularies each year. If you're on a Part D plan, they can change a lot from year to year, so you want to make sure your medications is still covered, what the costs are for those. And again, October 15th through December 7th, you can change those plans. So things to consider, I'm sure we all consider our budget, our medical usage, the flexibility that you're looking for, the desire for those extra benefits. So if you're only going to the doctor once a year, and you're saying, I'm going to pay my $10 or $40 copayment, those extra benefits sound really good. Well, I'm getting money towards my glasses, my dental cleanings, the drug coverage. Great, it sounds great. But if you're dealing with chemotherapy, radiation, MRIs, you may not really care that much at that point in time of the extra money towards your glasses. You might care more about, is this completely covered? Am I have the flexibility? So there's weights and balances that I always say, if one plan sounds really good to you and you're like, why would somebody else ever think about that plan or the other way, you just found the right plan for you. So sometimes, as I said, it's a very clear path, and other times it's lucky enough that they both sound good. I can go either way. And prescription drug coverage is always a factor too. So final review. Medicare supplement plans, typically more expensive monthly premium than Medicare Advantage plans, with lower cost share for Medicare covered services. The plans do not include Part D or additional benefits, but you can see any provider that takes Medicare, no referrals, no co-pays, predictable cost. As opposed to Medicare Advantage, typically less expensive monthly premium than Medicare supplement plans, with additional cost share for those Medicare covered services. You're paying co-payments, but most plans include Part D and additional benefits. Just remember, you're using a network of providers. It's coordinated care, co-pays as you go, but there is that out-of-pocket max for your protection. And here are some helpful resources. Here's the Medicare number. They can help you find that best Part D plan, the Social Security number. Shine, you don't have to call that number. You can make an appointment with Shine right here at the Council on Aging. Shine is independent of any health plan. They know all this information and more, and all the product information, so they're a great resource. The Mass Medline number, this is another number that you can call. It's a group of pharmacy students. They'll take your medications, they'll put it in the computer system, and also run that report for you. Prescription Advantage, this is an assistance program for the state of Massachusetts. It has a very generous income guideline, no acid test. Many people qualify. If you do, whenever you get into that coverage gap for Part D, you continue just to pay co-payments. And here's the Blue Cross number. We have our product information on our website. We have educational materials on our website. You can call us with any questions. We are out in the community doing sales presentations at hotels where you can hear our product information. We do webinars daily on our product information, and I'm sure our other carriers in the state, they also offer that. So there should be no limit for you to be able to get product information from the companies. But hopefully from today's presentation, you can make more sense of that when you look at it. Okay, when I'm looking at a supplement, I know I'm keeping in mind I'm not paying co-payments, but I have to buy a separate drug plan. When I'm looking at these Medicare Advantage plans, I know it's all in one, medical prescriptions, but I'm going to pay some co-payments along the way. So that's it for the presentation. Any last questions?
Do you know when they're coming back here to present like Blue Cross products? Did you say that was going to be set up for next month?
So for Blue Cross, we typically don't come into the Council on Aging and present our product information. We try to stay more educational in the Council on Aging building.
Okay.
But we do have sales presentations in this area. We're in Foxborough. We have them, we usually do them at the Holiday Inn in Mansfield.
All right.
And those would be right on our website.
Okay.
Like, you know, after this presentation, I can sit with you and ask any questions you have on our products. I'm happy to help you.
Oh.
If you're a member.
Could you speak to Medicare's policy on corrections for billing after services have been done? Because with dementia and seniors and medical emergencies, you don't always get all the information up front, and things happen very quickly. And so I'm curious to know what kind of backup corrections there are for patients after the fact.
I'm not sure exactly what you mean by like correcting.
Can I give you an example?
Yeah, sure.
I know someone that had cataract surgery recently. It was through a PPO,
Yeah.
and they went to the doctor, and this was their first surgery for vision. It was required by their primary care doctor, but they received a bill for special laser surgery, and it was in thousands of dollars, $2,000 per eye. The total fell right out of the annual limit for Medicare. Later they found out that it could have been covered by their insurance as deemed necessary by their primary care doctor, but whoever did the process, the procedure, billed them full price. I don't know if they called it laser surgery or not required. And that's what I mean. There are doctors and people out there. Patients are not always given all the information that they need at the time, or maybe they don't understand what they qualify for or what they're getting, and then they end up with these humongous bills after the fact.
So I would say like in that situation, somebody was on a PPO plan, so to take themselves out of that mix, they should just call their PPO plan and have the PPO plan deal with that, calling the doctor, having the doctor resubmit it. So because they're on a Medicare Advantage plan, hopefully they didn't pay it. If they did pay it, then they're still working with the Medicare Advantage plan to work with the doctor to get that back. So if you're on a Medicare Advantage plan, you're working with the company to deal with that situation, take yourself out of the mess. If you're on Medicare alone, you're going to deal with Medicare. If you're on a supplement plan, The plan can help you a little bit, but really you're more dealing with Medicare because it's, we're waiting for Medicare to pay. So if they need to resubmit to Medicare first. But in that situation, that person should have just called their member service with their PPO plan. And anytime that somebody gets a bill and they're unsure, the first thing you should do is not pay a bill and call your healthcare carrier, and they can help you decide if that's something that you owe or not. With the supplement plans, you shouldn't be getting bills. So other than that Part B deductible, with the Medicare Advantage plans, you should be following the benefit design. So if you're on a Medicare Advantage plan and it says your hospitalization costs $200 a day, and you get a bill for a hospitalization for $20,000, well, you should never pay that. You owe $200 a day. So, you're looking, hopefully, there's not a lot of billing that is getting confused like that, but if it is, you work with your plan to
It happens
do
quite
that.
frequently.
Yeah.
In a situation like that, where the patient finds it difficult to pay, if there is a dispute, who usually ends up, the loser with? Is it the patient or is it the service provider?
Yeah, I don't know. It's really hard to talk in hypothetical situations, but in a situation if somebody was billed incorrectly and the insurance is supposed to pay that, they'll work and the insurance will pay it. If the number was there and they signed an agreement that says this isn't a Medicare covered benefit, this isn't covered by your plan, then it's going to be debatable, like go to grievance or something. I don't know. So it's tough to say. But we're talking about all the worst case scenarios today in this presentation. And I'm not an expert on behind the scenes and the coding and all of that. My expertise is here's Medicare, how's it work, here's the types of plans. And most people I can tell you that go on to Medicare plans are very happy with the plans that they choose. And if you're not happy, you have this time period to change every year.
I have another question. Maybe I'm in the minority here. My situation is unique. I am over 70, but I don't have Medicare. I am on my wife's group plan.
Yep.
For the time being, she's working, but pretty soon she might retire and then, both of us go on. Right now, is there a way of comparing whether it is beneficial for me to go on Medicare and she be on her group health coverage? Is there?
Sure. Yeah, so thank you. So what happens is when people turn 65, if you're not actively working or your spouse is not actively working with health insurance through a company with 20 or more employees, you usually need to go on to Medicare. So let's say your wife is working, she's working at a company, more than 20 employees, she has the group coverage, you're on that plan, and you're thinking to yourself, is it going to save me money to come off of that group plan and go on to Medicare myself? You can run the math and see. You can look at how much is it going to cost if it's just an individual plan of that company. And then you're going to take into effect that if you go on to Medicare right away, you're going to pay $164 a month to get Medicare. And then you're going to add an additional private insurance onto it. The other thing that you have to understand is that if you have medications, your medications usually through a group plan, you never worried about the actual cost of the medications. You just pay $10 or $20, whatever the copayment is. When you come onto a Medicare Part D plan and you lose group coverage, you only have a set allotment of money every year towards your medications. And if you use that up, you start paying 25% of the cost of your medication. So sometimes somebody might say, well, I only have one medication and it's $10 that I pay. Well, that's $10, but you have a group plan, that medication could be a couple $1,000s. Most likely you would know, but it's something you would want to check because you want to have a limited amount when you come onto a Part B plan. So for most people, they just continue to stay on their group plans until your wife retires or loses coverage. 9 out of the 10 times, it's better just to stay there. But I don't know your personal situation, so you could do the math out and see. But usually people end up just staying on the employer plan.
Did you say you had handouts for today?
I have some handouts you can take. It's not this presentation, but they have some resource numbers in there for you.
Thank you.
You're welcome.
So when you go on Medicare, isn't it automatic Part B gets deducted anyway? You don't have a choice whether you want it or not.
When you go on to Medicare, some people might go on to Medicare at age 65, and they might not collect until they're 67. So if you're collecting Social Security, your Part B comes directly out of your Social Security.
Correct.
But some people are going to qualify to go on to Medicare at 65 and not collect until they're 67, so they work it out to pay that.
Right, okay, that's it, yeah.
So.
First off, I want to say this presentation was awesome because you get the things in the mail and I can't read them at all.
Thank you.
I wish I had had this resource when I retired 2 years ago, but I retired during the pandemic and I had to do everything over the phone and it was a nightmare. But what I did find out is my prescription plan, I started at the very lowest. The guy I talked to on the phone, he said, "You're very healthy, your husband's very healthy, start at the very lowest," which I did. I have to tell you, in 2 years, the first year it doubled in price, now it's doubling again. It's absolutely ridiculous. And I also have to say that just by changing my pharmacy and going on Good RX,
Yeah.
I have saved a ton of money.
Great.
I use Good RX.
Oh my gosh, I can't, and talk to people, talk to your neighbors, talk to people you know who are on these different plans because it has made a big difference. And I'm here because I do have Med-X and I have Medicare and I have a supplement for my drugs and I'm done with it. I'm done paying all this money and I'm going on a PPO, that's it. So talk to people who have these things and it's so helpful. I had a friend who told me about Good RX. I had no idea what Good RX was. And you don't need a card, you don't need to pay anything, and it just cuts your prescription costs.
And are you in an Advantage plan? Did you
No,
say?
I'm in like Medicare A and B, and then Med-X,
Oh,
and then
okay.
I have a separate prescription plan.
Okay.
I have nothing for dental. Luckily, I've been at this
You're in the
dentist.
same position I'm in.
I've been going to this dentist for years, and he cuts my bill for me when I go, because I pay everything with a check.